Thank you very much. Basically, we've all said this was going to be bad, and I'm not reassured by what I've heard. The most important speaker was Sara. She tells us how it is in terms of the number of 2-week wait referrals and cold surgery referrals. It's not started yet. Some of these patients have been delayed more than 11 weeks. Stage shift upwards is inevitable here. We've got to get going faster than we are. The 5-point plan that I would come up with is, number one, get some COVID-free centers. Make sure every cancer center, someone takes a temperature at the door, someone takes a history, and if possible, weekly testing with PCR. The Premier League have done it, we can do it. The second thing, let's monitor cancer biopsies. They're the harbinger of what's to come. If you go around Imperial, which I did last week, to the lab, if you go around the private clinics in HCA in Harley Street, you can look at the fall off of total biopsy rate. It is very low, 8% of what's normally comes through in April, 12% in May. We don't know what June's figures are. The third thing, use all available capacity, just as the surgeons have done. Use the private sector. There are 27 radiotherapy private centers in the UK now, and there are 30 on top of that that can do chemotherapy only. So you've got 60 locations, more than that, that you can deliver if you organize them locally in a coordinate way. The fourth thing is coordinate the patients in some sort of regional manner, both coordinate and to abbreviate with accelerated programs of both chemotherapy and radiotherapy. College of Radiologists have set up models for doing that, and I think they're tremendous. Fast fractionation courses for patients with breast and prostate cancer, which covers something like 80% of the department's workload. And the last thing, if we can predict when the surge is coming, and I would predict it's not coming till September, let's instigate weekend working, 2 hours, double shift working, and so on. We've got to do this together. Solidarity, as we've heard, is the absolute key. But it is a problem. The NHS did so well with COVID, it can do as well with cancer. But we have to get going this month in June. Otherwise, it'll be a catastrophe as we move forward. So no time for complacency. We all have to move forward together. Thank you very much.
Karol, thank you very much indeed.